Let's get started. Okay, remember to go to the members only site to see any announcements and any changes. We now have a direct link to the Zoom calls, so doesn't change if you've already registered. The benefit of registering is you get the reminder. Please send in the cheek swab request form, either online or print it, along with your cheek swab if you send in a cheek swab. So I know what it is that you're requesting. Um, Everything else is not new there. All right. So let's jump into the questions. Have you heard of the natural viral therapy called Rigvir? Info is at rigvir.com. I suggest everybody go and look at that. Rigvir is like an Epley's toxins that I wrote about in my book. It's actually giving a mixture of different viral toxins to stimulate an immune response. It can be very beneficial for a lot of different cancers. It says this person wrote the protocol is administered here in the States by a doctor in Minneapolis. So I don't know of that doctor. I do know that this doctor is got to be probably trying to fly under the radar, or he's going to end up getting cited by the Minnesota board. So please be praying for this guy who's trying to do some good for people. So it is an injectable, and what it does is it stimulates an infection, and which stimulates an immune response. No different than what we've been saying for years and years, that it can actually be good for a patient with cancer to get an infection, to get a cold, to get a strep, to get a something like that. That's going to stimulate an immune response. Of course, that's within reason. It doesn't make any sense if a person is super, super ill and is cachectic and doesn't have the strength to administer an infection, or if they're undergoing immunotherapy or chemotherapy or something like that where they have a diminished white blood cell count. But when you get a cold, or when you get a strep infection, or when you encounter somebody at work that has a cold or a strep, and viruses and bacteria are ubiquitous. They're everywhere. You go everywhere. So this is the whole foolishness of this whole 2020 thing, that you're going to wear a mask and not have a virus exposure. Just if you're wearing a mask thinking you're protecting yourself from a virus or even a bacteria, you are uninformed, let's say. So you are going to be exposed to things, and that is what builds your immune system. So what's a strong immune system? Why should you have your kids go play in the dirt? Because when they're exposed to different pathogens that are fairly harmless pathogens, your body then has to respond to those pathogens by stimulating an immune response. And if you fire a Th1 and then a Th2 B cell response, you'll develop antibodies to those pathogens. And that's the definition of a quote unquote strong immune system. I have a strong immune system. What does that mean? That means I have a lot of circulating antibodies against a lot of different pathogens. That's the definition of a strong immune system. So the more that you could expose yourself to different pathogens that aren't going to kill you, and your body can fire a Th1 response, which is a natural killer cell response, and then fire a Th2 response, which is your B cell response, where you make antibodies, and you make antibodies to that pathogen. Now you have circulated antibodies to that pathogen, and that's really what you want. Well, natural Rigvir therapy is just that. You're firing an immune response. It's giving you a pathogen so that you fire an immune response. Not enough of a pathogen to make you sick, but just enough to make you fire an immune response. So that's the idea of that. Now, it was Epley's toxins. this guy created it back in the 1950s, I believe, and he was riled as a heretic to the medical profession, and all this stuff was just horrible. So now they're trying to do it again. This is not made in the United States. This is a drug, so we can't administer it in our clinic. But okay, this person is writing about their caretaker of a person. So this is why it's written in the third person. Lisa's concerned and not sure about the growth in her neck. Her hospice nurse told her that it's from the steroids, but she's worried. Should I send a photo? Yes, you could send a photo with in an email, and we should do another cheek swab. So that's what would be the appropriate thing. So it's always good if there's something going on physically that you want me to see, and you're doing a cheek swab, then send that. Just like tests. Okay, you got some blood tests back. I'm not going to interpret your blood test, but send me the blood work with your cheek swab stuff. So send that to me. Send it at info@Connors Clinic, or you can send it at labs@Connors Clinic. So yes, send in a photo, send in your cheek swab. Also, do you recommend her doing a cheek swab? Yes, do that. She's had been able to do coffee enemas until a week ago, but now she needs help. And it's so very painful to get up and down from bed or recliner, etc. I have a herniated disc, and I am very limited to help her. I have been assisting until illness and injury prevented me from helping, wondering what alternatives we have to giving enema. So first of all, I would look on the member site and look at the easy peasy way of doing a coffee enema. So that doesn't require you to lay down. You can stand up in the shower and do the enema in the shower and step out and use the toilet. So look at the easy peasy way of doing a coffee enema if you're going to do coffee enemas. Now, certainly, if it's too difficult physically to do a coffee enema, then you could do castor oil packs over the liver, or just heat packs over the liver can be beneficial as well. So, don't cause an injury trying to do a coffee enema. How often do you recommend using the PEMF machine? So if you have a PEMF machine, I would say once or twice a day. I think this is supposed to say more than 2 times per day. I would say no. I would say once or twice a day with the PEMF machine. Are there any natural supplements that could help with pain? Look back at some of the other past Zoom calls, but your best natural supplements that are going to be for pain is going to be CBD, turmeric, which is your curcumin, and then all your flavonoids, which will be your white willow bark, your boswellia, your green tea extract, your resveratrol, things that are in our product called the Clear Inflam product. The Clear Inflam has really all those things. Your number one natural thing for pain is going to be THC, but a lot of people don't like the way THC makes them feel, because that's the active component of marijuana. Can I return to normal stature with this treatment? I'm not sure what you mean by normal stature. Can you heal by doing everything you're doing? Obviously, God's in charge of your healing. It's our responsibility to do everything you possibly can to help yourself heal. I know that the coffee enemas are often the best way to detox. Are castor oil packs the second best way to detox, or foot baths? So understand the 7 phases of detox. So castor oil packs, coffee enemas, are working basically on stimulating your parasympathetics and stimulating your liver to help with detoxification pathways. Coffee enemas are helping with the gut as well. So both of those are beneficial. There's other things too, like saunas can be really good, or like I said, just a hot pack over the liver can be really beneficial. So anything that you can be doing to helping with detoxification. And I'd recommend that you look on the 7 phases of detox. Remember, all of our members have access to all of our courses. This is the course I'm talking about right here, the 7 phases of detox course. You have free access to that using the same login that you have with logging into the member site. So make sure you utilize that. And that goes over all the different phases of detoxification and how you want to support those. And yes, this person should do another cheek swab. Make sure you send in a picture of that spot that you were talking about. A couple of weeks ago, someone in the Zoom asked if you had heard of Dr. Gil Letterman with radiosurgery in New York. Did you get a chance to look into him? And if so, what might be your thoughts about him? I did not. All I would see if I looked into him would be the same thing that you would see. You'd see a website, you'd see some information that doesn't really give you, any data about his patients, and you'd have to call them directly and get a feel for them. And I can't call and make an appointment with him to do that. That's something you're going to have to do if you want to move forward. There's really no way for me to gain any more knowledge about a practitioner than there is for you to do that. And it actually would be easier for you to do that as a potential patient because they're not going to talk to another practitioner. So I don't really have a way to answer this question. I don't have really a way to do that. Thank you for the cheek swab information. I stopped taking my SCIT capsules a couple of weeks ago, getting kidney pain when taking them. Do you suggest that I start with the tea that you have instead of the capsules? If I recommended the tea, then yes. If I didn't recommend the tea, then no, I wouldn't. But if I did recommend the tea, then I would say yes. The SCIT tea is a blend of herbs. So there are SCIT capsules. You can get those herbs in a capsule too. But I think one of the key benefits of the tea was the fact that it was a tea and you were sipping it. You're supposed to sip it for a half an hour. That's the proper way to take SCIT. On a fairly empty stomach, put the tea in a cup, add hot water, and you sip it like a tea for half an hour. Now, I'm not sure that, it makes that big of a difference, but certainly that's why we have most of you doing the shake, because I think there is a benefit in the absorption rate in taking it that way. So, and it's not across the board with everything, so don't quote me completely on that, but that is the way that you're supposed to be taking SCX. So I try to, we don't carry the capsules for that reason. We only carry the liquid. Also, we had our appointment with the oncologist today and shared with him that we are going to discontinue the medication. He took it very well, but had to add that some hardy cells deliver resistance to therapy, and if I have to go back on treatment, it may not work. Is this a scare? Well, you could say that literally about anything. Well, if you have to go back on treatment, it may not work. Well, if you stay on this, it may not work either. So, I mean, there's no way he doesn't have a crystal ball to know what's right for you. You have to, and nor do I. So, you have to pray about what you want to do, and you do what you feel like what God is leading you to do, and don't let anybody scare you either way. Don't let a natural doctor scare you that, taking this stuff, this is going to kill you. That's why I just think that that's so immoral. Either way, you're doing that. Using fear tactics, I just think is immoral. Also said we can't go buy tumor markers. Well, I would agree that you don't go buy anything things specifically. You go by a lot of things. So you remember, we've said over and over that you don't judge your progression or regression of your cancer based upon one test or even two tests or even any objective tests. You have to guide it with again with prayer and which way God is leading you, and you factor in, we're called to use wisdom, so you do factor in, what do my blood work look like, what do my PET scan look like, what is my any other scans that I'm doing, and how am I feeling, and then you make that decision based upon factoring those all out, taking it to God in prayer. So how soon do you suggest to have markers and other blood work drawn? Well, doing blood markers and blood work is not, real expensive. So we have some people do them every month. So some people do them every other month. So whatever you feel comfortable with. So it's got to be how you feel comfortable. But in a just try to take the conventional wisdom that's out there. I'd say every 30 to 60 days makes sense to me. If I was in a greater state of remission, I'd go longer. But you're talking to somebody who hasn't had their blood work done or any tests done for well over a year. So should I? Depends on who you ask. If you're asking me, no, I'm not going to. I don't need to. I'm doing fine. So I don't rely on those objective things. Is that foolishness? Well, depends on who you ask. So, but it's my body, and I have to answer to God with those decisions. But I'm not telling you that's what you should do. So, in regards to histamines, one of my breast cancer drivers is histamine. I avoid histamine foods as much as possible. I understand that leftovers grow histamines. Well, I wouldn't say they grow them, but the older food is, the greater amount of histamines it is. Does it happen with all leftovers, or just that are even foods that are non-histamine foods? Good question. Well, there's some histamines in pretty much everything. So the older the food is, even if it's a very low histamine food, it'll have more, but still probably not anything to be concerned about. So if it's a low histamine food and it's a leftover, I would not be concerned with it at all. Don't even consider that. Don't even take that into your account. And this gave an example. I cut up some green cabbage, purple cabbage, blah, 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 in advance for a week. Is it growing histamines? I would say probably not. So you can look at histamine. You can Google food histamine lists, and you can see 10 lists, and they can have a great difference between those 10 lists. The reason is that if you sent these things to a lab to test for histamines, it would be all over the board. So let's say I had sauerkraut, and then we had another thing of sauerkraut. We sent it to the lab. It would have different readings, depends on the age of the sauerkraut, and sauerkraut has histamines in it, and everything. And so it just could be very all over the board. So that's why we say, when I've written about histamines in my videos about histamines, it's not about eliminating histamines. It's about just reducing them. So, okay, nuts have histamines. That means you shouldn't have any nuts? No, but maybe don't have just a bowl full of nuts for a snack, So strawberries have histamines in it. Grapes don't have as many histamines. So maybe just don't have a bowl full of strawberries. Doesn't mean you can't throw some strawberries in your smoothie. You're just trying to reduce your amount of histamines without going crazy about it. For the Navarro test, the acetone says to have 100% acetone. Mine says it has 100% acetone, but then it lists one other ingredient listed. No, you can still use this acetone for the Navarro test. Now, I will say, I will ask your opinion on whether your Navarro test is accepted, because the last I heard, they're not accepting the Navarro test. So If they're now accepting the Navarro test, that would be a great thing. So let us know if they're accepting the Navarro test. At my last lab draw, I had my cholesterol, my thyroid, my cancer tumor markers, and so on tested. I am due for another one done on March 10th. I'm wondering if I should have all these same things tested again. I'm also struggling with hot flashes and night sweats. Let's talk about that second. So back to this question. Should I have all these things tested again? Oh, why not? Unless cost is a factor for you, then I would just go and test them all. So yes, I would just do them all. Also struggling with hot flashes and night sweats. So hot flashes and night sweats, really, could they be a function of thyroid? Maybe. Hot flashes and night sweats are going to be more a function of your estrogen and progesterone hormones, not as much with your thyroid. So if you want to get some more insight into that, you really need to do a Dutch test. And you can order that right on our website. This is an acronym for a dried urine hormone test. And this is the best and really the only way to really test all your hormones. So we do a Dutch complete through Precision Labs, and I think that's the most accurate and researched lab out there that's performing the Dutch test. And it really gives you a really nice breakdown of all your estrogen, progesterone metabolites. I've heard that you refer to adaptogens and wonder what exactly to order. Maybe if you're not going to do the Dutch test, then it'd be good to do another cheek swab test to see what adaptogens would be best for you, unless you want to just try some. There's multiple adaptogens on the store, probably for hot flashes, and having them at night if you're just going to give a product a try. I would try the Corticlear and take that before you go to bed. Still reviewing my genetic info, one supplement, histamine scavenger, is needed, but I also see HistaClear and Natural Clear Hist. Which one do I take? So histamine scavenger is the one that I would take. So this is the one that I would take. And the histamine scavenger is, and it's our private label, it's called Clear Histamine Scavenger. It is, I think, the better. So let's define these. Histamine scavenger is a product that will help pull histamines out of your body. Natural Clear Hist is another product that will help pull histamines out of your body. Totally different than HistaClear. So these two here, Clear Histamine Scavenger and Natural Clear Hist, are just two products that have a different components in them. That's why we carry them both. That's why we've private labeled them both, because some people will do really well with the Natural Clear Hist, and some people will do really well with the Clear Histamine Scavenger. And the reason why I'm recommending this one is a greater percentage of the population do well with this blend of nutrients in the Clear Histamine Scavenger. They're different. There's some crossover, but they're very different. The HistaClear is totally different. HistaClear is the DAO enzyme that breaks down histamine in the gut. Neither one of these have the DAO enzyme. So the HistaClear, the only ones that we have with the DAO enzyme, well, we have multiple, but the HistaClear and the ABP1 assist is also has the DAO enzyme. So why would you prefer a DAO enzyme product over one that will pull histamine out of the tissues? Well, if your main inflammation is in the gut because of histamines, then you could use a DAO enzyme product. We have some people that have mast cell syndrome where they have severe histamine issues. They really need to use both. So they need to use Histoclear, the DAO enzyme, or ABP1 assist, with each meal. And then they take the clear histamine scavenger, and some even take the natural clear hist 2 as well between meals to help pull, you absorb that and you help pull that out of the tissue. You really don't absorb the DAO enzyme. It's really working in the gut. So they're two different, completely different products. So I would take the clear histamine scavenger. My vitamin A is low. So, well, actually, we don't know if your vitamin A is low based upon your genetics, but you have a gene that helps you utilize A, and that you have defects on, and then I recommended vitamin A. So this is the product that I'd recommend for A. I told you last week that I was going to tell you which one it is and email you. I apologize because I forgot. It's a Designs for Health product, Hypo Emulsa A. I can't remember how much it is, about $30, but you only want to take a couple drops. It's a very concentrated product. And you only want to start with taking like 2 or 3 drops, not dropperfuls, drops. So this whole bottle is going to last you, an entire year or more. So just 2 or 3 drops per day of this, because I originally suggested the 80K, and that's usually good for everybody, but I know you have issues with D, and your D levels were already really high. So this one does not have D in it. This is just the A, and it's very concentrated. Okay, now your chat questions. These new supplements, and mainly the supplement causing less appetite. Is that normal as I am losing weight? I don't know. I don't think the supplements are necessarily causing it. Maybe they are. Just you eat because you know you have to eat. So just eat anyhow. Just try to really push through that. In reference to the question about losing weight, at times my stomach hurts, etc. Maybe detoxing, trying to make sure it's not my cancer or the progression of the lymphoma. Yes, try doing some castor oil packs over your stomach area too. That might be really helpful too. So, and if you don't know how to do, like when I say castor oil packs or coffee enemas, there's information on the coffee enemas, but castor oil packs, look up in the blog. There's a blog on castor oil packs, I'm sure. So look up in there, so with directions on doing that. As far as SCFT, you stated to sip it in hot water for 30 minutes. It also, over 30 minutes, turns cold soon after it's heated. So this cannot be added to daily smoothie, correct, with the other things. Yeah, it's best not. I mean, you can. I mean, the argument that people have is, goodness sakes, this is just an herb like all the other stuff I'm taking. Why can't I just put it in my smoothie? And believe me, I've had people over the years just do that. Was there any harm in that? I don't know. It's just that Renee Cassie, how she told people to take it, how she learned from the Ojibwe chief was to put it in hot water and sip it for 30 minutes. Put it in a little one of those insulated cups if you have to keep it warm. I'm not sure that the temperature change over 30 minutes is a big deal. I don't think so. Lisa has lost about 4 inches in height. Had not seen her because of my injury and was shocked at how much she shrunk. So if a person has lost height, what would cause a person to lose height? Well, it can be just because of their posture, so it appears that they've lost height. But if they're standing up perfectly straight, and you measure them over time and they're losing height, it has to be because of one of 2 things. We can lose height as we age because the imbibition of our vertebral discs decreases. So there's fluid in the discs between the vertebrae, and we lose fluid over time as we age. So we will lose height. That's a total of maybe an inch, inch and a half, maybe 2 inches. If you're 85 years old, you'll lose 2 inches in height. If you've lost like 4 inches in height, pretty guarantee you have a pathological fracture of a vertebrae. That means a vertebrae has fractured the body of the vertebrae, which gives the height. So if you looked at a picture of a vertebrae, the square part of the vertebrae is what's the weight bearing portion of the vertebrae. That's what's giving the height of the vertebrae. A pathological fracture, that vertebrae can just like crush down. So if the person has metastasis to a bone, and the person has cancer with metastasis to the spine, it's not uncommon to have a pathological fracture of the spine and you will lose height. Also, do you use homeopathy? Yes, we use homeopathy all the time. Also, she has a growth on her chest. I missed the answer. I sent this first. Nurses think it's from the steroids, but she's afraid it's the cancer coming around to the front. What do you think? My answer to that was send a picture in with it with her cheek swab so we can look at that. I know you have designed this specifically for Lisa's sickness because her cancer is considered breast cancer that metastasizes to the bone. How do you classify this for treatment? So when you have cancer that metastasizes to someplace else, it's still breast cancer. So if I have breast cancer and it's metastasized to the bone, it's not now bone cancer, it's still breast cancer that's in the bone. So if it metastasized to the liver, it's not liver cancer, it's still breast cancer that's metastasized to the liver. So you're still treating it as breast cancer. Even an oncologist is still treating it as breast cancer. They're not giving you a liver cancer drug now. They're still treating the breast cancer. So yes, I hope that helps. So, and you're just getting caught up as her caregiver. Make sure you go on the full membership site and you spend some time looking at that. Look at some of the past Zoom calls. We have 7 years full of Zoom calls that you could spend your entire life listening to. But we do have 900 blog pages that if you're searching for something specifically, on any of the site pages, you see that little eyeglass thing that you can click on and you can search for a topic. Okay, any other questions? I gave her, this is a homeopath for joint pain, and it helped last night because she has been in much pain. So for those who don't know homeopathy, you can use homeopathy, especially in today's age where you can look up the homeopath for specific things, and you could actually get yourself a homeopathic kit that has different homeopaths for different conditions. Like this person, being Lisa's caregiver, gave her this homeopath, and she must have just looked it up, or maybe she has some education in homeopathy, but she looked up that homeopath. This would be good for joint pain, and can it really help? My daughters give my grandkids homeopaths all the time when they're teething. There's a specific homeopath blend for teething. There's a specific homeopath blend for helping with sleep. There's different homeopath blends for colds and things like that. It's really, really big in the healthy moms community, which my daughters are very active in. They use homeopathy all the time for different aches and pains. So when you talk about using something for, you could always try homeopathy for that as well. The downside is sometimes nothing seems to work, but it can be remarkable. So some people say, oh, it doesn't make any sense, homeopathy doesn't work. Okay, if it works on a little baby who is not going to have any idea of what they're taking, you can't tell me that it doesn't work. So cell salts, would cell salts be okay to take in the morning routine? Yes, so cell salts is another homeopathic remedy that's fine to take as well. Nothing that we do, nothing you're doing with the Rife goes against anything you're doing homeopathically. I mean, technically, The Rife, I mean, really getting down to it, is a homeopathic treatment because you're using frequencies. That's what homeopathy is it's the frequency of something. That's the argument against the standards of care have against homeopathy is if you take that homeopathic substance and you send it to a biochemistry lab, you won't find any. So if you have, let's say, arnica homeopath, you won't find any arnica in that substance. Well, it's the frequency of arnica that's in that. And that's how it actually works. And it works on the basis of likes your likes. So it can be a very beneficial addition to help with symptom patterns and such, and uh, immune stimulation and things too. So good thing to add is homeopathy. All right, well, we'll say goodbye for another week. Make sure you get your questions sent in on the member site. I think somebody sent in a question on the email now that I just said that. And that's why you can't email questions in. I'm sorry, they will just get buried. I'm not kidding. I get 150 emails a day. So I will not remember to get them into this. You gotta send your questions in only on the member site. So please don't email any questions in or you'll be mad at me. I don't want you to be mad at me. All right. Know that I'm praying for you guys always. I love you all, and I will see you guys next week. Bye-bye.